We're here today to talk about digital literacy and telehealth. Now, telehealth is increasing in adoption and may become the new normal, but telehealth can require a variety of digital literacy skills like connecting to the internet or downloading an app, using a specific email, or even updating their settings to make sure that they're secure. Not everybody has these skills. So today here, I'd like to give you some tips to help improve the patient's digital literacy. Now start where the patient is. What technology do they use every day or often enough they feel comfortable with it? How do they use it? Are they using it just to surf the internet? Are they using it to talk to grandkids or family members over FaceTime? Whatever they have, let's build on that comfort level. It's a good idea to help the patient make a test connection ahead of the visit, including assessing their available bandwidth. Testing ahead also allows you to troubleshoot if they have any issues and when they're not feeling nervous about their visit and not making it in time. So it makes a much more relaxed time, and you may have to do more than one test connection, and that's okay. We want the patient to be successful with the technology, so be sure to explain the technology, even if it's just click the link. Just knowing that much can be a big help. And then make sure you give them detailed instructions and include screenshots. It's also a good idea to use larger font because it's easier for a lot of people to see. And then help them by being clear on what is expected of them at the actual visit. Talk about the environment, whether that's turning off ceiling fans or it's turning down the TV, the angle of the screen, and then also what to bring to the visit. We've had people very frustrated when they didn't think of the telehealth visit as a regular visit, and so didn't bring insurance cards or medications or their blood pressure readings. And is it okay if that blood pressure readings are on paper, or are you wanting them to download to an app somewhere? Let them know ahead what's going to be expected of them. That'll help a lot with their anxiety. And we all know that when we're more comfortable with other things, then the digital part of it just isn't as much of a problem. And then tap into community partners. I can't emphasize enough how wonderful some of these people are. And if your patient's used to going to a senior citizen center all the time, for example, a lot of times they'll offer special little classes, and they don't feel out of place because there's other people like them there taking the same classes. And then the community health workers can be a great help, especially if they can come to the home and help with that testing part, or even be there the first time they have a meeting with the provider and to get them up and going, and then they can always leave. And then some schools and libraries actually have dedicated telehealth rooms for people that they can go and use. And if they need assistance in getting the connection, they can have somebody there at the library school actually be there to help them connect. It can be a very successful partnership. Here's some more information that might be helpful to you. Just remember that the ultimate goal is for the patient to have digital literacy at a high enough level that they can have a successful and hopefully less stressful telehealth visit. Thank you for listening.